I'm Sio Hernandez, and welcome to Connect. On today's program, we'll let you know about a few events that you might be interested in checking out. We'll give you a tip about children's oral health. You'll meet our CHI staff who work with our Children's Health Initiative program. We begin with a great program that inspires young children to make reading fun.
Hi, I'm Jenny Ocone, Executive Director at Parent Services Project, and what we're doing here today is celebrating We Read, and it's an effort countywide through over 20 different preschools to have a synchronized story time all happening at the same time to talk about the importance of reading. We Read is part of what Parent Services Project does through Raising a Reader, which is a take-home book bag program that every child in over 40 classrooms here in Marin bring home so that they can share books with their parents. This bag really is a symbol of the various connections that we're trying to make with children and books and their families and the larger community. And so the child gets the book bag, they're always excited to bring it home, share books, look at the new books that are there with their families, but then later when they get the blue book bag, it's also a symbol of them being able to go to the library, get books, any books that they like there, and it connects them to the larger community.
Hi, my name is Jose Varela. I'm the Assistant Public Defender for Marin County. Today I had the grand opportunity to be able to read to a bunch of kids in Spanish to encourage them as part of the We Read program to read. It was wonderful not only to read to the children, but to also have their parents present to let them know how important it was for me growing up to have my parents give us books, take us to libraries, and to realize that reading is a magic place that opens up a whole lot of worlds. So this was a wonderful invitation for me, and I was happy to have done it. In this reading, I had the opportunity to use Spanish, and it was wonderful to see the way Spanish is used. Sometimes words are translated differently, and they open up different worlds for people as they hear different words. But the one thing that's beautiful is just language itself. That for the children to hear language and to hear it used, and in this case, it was a rhyming story, and just to hear the rhymes in their own native tongue, I think was really kind of a fun thing for them.
Raising a reader is important because actually 1 in 3 children enter kindergarten with not enough pre-reading skills to succeed right away. They're not at a level playing field. And about 50% of parents do not share books with their infants and toddlers on a regular basis. So what Raising a Reader does is it helps families to really get that routine down. We supply Raising a Reader kits to the different preschool classrooms throughout the county, and those books are rotating books each week. Each week the child brings home a book and has the opportunity to share it with their family. At first, we do training with parents around the importance and how children's brains are developing so greatly in the early years, and how important reading is. And if parents may not speak English, we do have books in other languages that we also send home. But the importance is sharing the book. So even if parents are not literate in English or in their own language, they can talk about the pictures on the page, and they're establishing that very important bond with their child that books are important. Pre-reading skills are so important for young children because it helps them be very comfortable with books. In some cases, the children in our program don't really know how to hold a book, don't know how to take care of a book. They don't see family members reading books, and so while they may have stories that are verbal stories, the importance of really looking at books and feeling comfortable with books when they enter kindergarten really sets them up to succeed. And we have seen that parents that have gone through the program, that there's a marked difference for their children when they enter kindergarten, that they do report that they're reading more regularly, and the children, when they get to kindergarten, they may see some of the same books that they've seen in their book bags and recognize them, and that just sets up that comfort and that ease with learning that they otherwise wouldn't have had. We work with the County of Marin in a number of different capacities. In regards to the Raising a Reader program, we offer the program at the Connection Center for the participants that are in the Women, Infants, and Children Clinic. We also partner very closely with the libraries. I hear from the teachers that we work with and from the families that they realize how important reading is. And it really just is the spark of the beginning, because we're in the early childhood settings. It's really the spark of families knowing that their involvement is important, even if they're working, even if they're busy, that being that part of their child's lives and helping them in their educational journey is something that's important throughout. And so it really sets it up, and it's a really important and tangible way that they can take part in that.
And if you want more information about the early reading program or We Read, you can contact Parent Services Project at 415-454-1870 or online at parentservices.org. Children's oral health, preventing tooth decay. Tooth decay is the most common childhood disease. It's preventable. Baby teeth can decay. Decayed baby teeth can affect overall health, position and health of adult teeth, speech development, and self-esteem. Take your child to a dentist by age 1 for an exam. Help your child brush twice a day until they are 7 or 8. Start using a small amount of fluoride toothpaste at age 2. Avoid sugary snacks. Eat healthy snacks instead. Do not share drinks, eating utensils, gum, or toothpaste tubes. You can pass bacteria to your child that can cause decay. Never put a baby to bed with a bottle unless it's water only. Other liquids can decay teeth. Look in your child's mouth at least once a month to check for decay. Ask your dentist for help. Where to find more information? Marin County Dental Clinic, 415-473-5450. Marin Community Clinics, 415-448-1500, or on our website. Children's Oral Health Project, Jennifer Colombo, RDH, 415-473-4248. Or the Connection Center Information Desk. Next is a service that's really important. It's our Children's Health Initiative.
My name is Margot Hansen. I'm the program coordinator for the Children's Health Initiative here in Marin County.
Hi, my name is Victor Meneses. So I work for the Marin County Health and Human Services for the program Children's Health Initiative.
My name is Elizabeth Teles. My title is Support Service Worker Bilingual.
My name is Marie Trejo, and I'm a support service worker here, bilingual.
My name is Anna Mira, and I work with the Children's Health Initiative.
The Children's Health Initiative is now being run under the Division of Public Health in County of Marin's Health and Human Services. It is an insurance program for children.
The children that we can serve are beginning from the ages of 0 to 19 years old.
So when the families come to our office, we try to help them get in the health insurance for their children.
We bring them into our interview room and first make them feel comfortable, and then start the interview process.
We'll ask them questions regarding their family size, income.
How many children we're applying for, and their citizenship, if they were born here or if they are resident from here.
We do by income guidelines, and that's how I determine in what programs they qualify.
We can almost insure every child that comes through our doors. If they're not eligible for Medi-Cal, they're almost always eligible for one of our programs.
When they come in to do that application, we make it very simple for them because it's very overwhelming for the families.
And, we'll help them determine which program will be best for their families.
We offer the different programs, which is a Medi-Cal, Healthy Families, California Kids, Kaiser Permanente, and for pregnancy we have a special program which is AIM program. And it covers all the pregnancy and delivery for the babies.
If they come to the right place, the process to get these children insured can be just take 2 weeks.
Once we get the families into the program, we check in within a month to make sure they've found a home doctor for the children and that they know how to use access to the health insurance.
And then we renew them. We get a list on some of the programs annually, and we'll renew them. We call everyone on the list.
We want them to stay on the program so they don't lose health coverage. So we get them into the office to help them with the renewal process also.
We're the experts, you know. Try not to do this on your own because a small mistake can create a big problem.
We are free. We don't charge.
You come in here with us, we'll know what you need to bring. We'll tell you from the first day we meet or the first time we talk on the phone, we're going to tell you, okay, this is what you need to bring. And I think that makes a big difference versus you doing it on your own, just reading, you know, the information that's there versus coming to someone that does it every day.
Well, this is the fastest way for their kids to be insured, coming to us, to the experts, and we are the experts.
The cost of not insuring these children is just sort of a basic common sense. They say that for every dollar spent to insure a child or to have a healthy child will save you $7 in the life of the child in health risks. I've read that 1 in 10 children in the United States is uninsured. I'm sure it's a lot higher now because we're seeing a number of people losing their jobs that before wouldn't even show up here, wouldn't even know about us, come in.
We have a variety of families that we are helping. Lately, with the different economy changes that are happening, we have noticed a rise in people coming in that are needing health insurance for their children and that have lost their jobs recently and they're on unemployment, which qualifies them for our programs. They're coming to us in tears and feeling uncomfortable because they're coming for help, and we let them know that they're at the right place, that this is the place to be for the health insurance for their children.
These programs are fit for people who do not qualify for Medi-Cal, although we will refer and work with them to get them to the Medi-Cal office, to people who can afford private insurance. So basically, these are for middle-income people or low-income people. Resources are not counted in these programs. They look at the family size and their income, and they're based on percentage of the poverty level. So that's how we find out which of the 4 programs that they're eligible for.
So I feel really happy to serve my community.
And I feel great by knowing that I'm doing a good thing, that I'm offering such a great service to all these children, especially in Marin County.
You've heard us talk in this video about wanting people to come down to our offices because I can't stress how important this is. This is the fastest way to get health insurance for your children. We can find an insurance product for almost every child in Marin. If you come here, it would take just a few weeks to process your application with our expertise, whereas if there's an error, if you do it on your own or there's an error, it could take 4 months. It could take a long time, and it gets very frustrating and complicated when you want your child insured. So we're standing in our lobby of 3240 Kerner Boulevard at the Connection Center. This is where you come right to the front desk behind me. One of our staff will come out and see you right away, or you may call and make an appointment if that's more convenient.
You can contact our Children's Health Initiative online or by phone at 415-473-3434. Marin County always has many opportunities and resources, but here are 2 that I wanted to tell you about today. Are you a young person who wants to be a part of the future of our Marin Health and Wellness Campus? Our Community Advisory Board needs you to be the voice for our youth. Contact Community Health and Prevention Services at 473-6166 or dwest@co.marin.ca.us. Look for the flagship, the Big Marin Literacy Program bus in your Marin and Sonoma neighborhood. It's a great way to read and play. Thanks for watching Connect. I'm Sue Hernandez, reminding you to listen with all your senses, know your community, and connect.